Welcome, everybody, to our podcast with Neo and Novel. It is a story about evil robots eradicating mankind and then growing them and using them as batteries for energy.
What are you talking about? I think you're in the Matrix today. That's
not what our show.
That's not what our show. We're not doing the Matrix today. And Neo, no. Sorry, you guys. Welcome to our podcast of the evil safety dudes.
That's right. All right. Thanks for reminding me.
All right.
I get off on tangents sometimes. Yeah. So we're the evil safety dudes, and what is our podcast about then?
The evil safety dudes. We're doing a podcast every week, every Monday about how not to die at work.
Okay, so from not getting sucked into a machine to not getting killed by an active killer, all things related to occupational health and safety.
Apparently also not about believing that your life is controlled inside of a computer program.
You know, if it's occupationally related, sure, we'll talk about it eventually. I would like to introduce my co-host today. His name is Mr. AJ Hanscom. He is an authorized OSHA outreach instructor teaching countless hours, thousands of hours every year on employee health and safety.
And I would like to introduce my co-host today, Mr. Aaron Iachino with the double meet the ball.
You did it right.
He is
Awesome.
the occupational safety and health nurse, bringing his nursing and expertise in the field of medicine today to talk about some of our favorite topics.
I almost thought you were going to say occupational health and safety nerd.
Nerd?
I felt like
He's
that
my
was coming.
occupational safety and health nerd.
We should be the evil safety nerds.
Which isn't a terrible idea.
Evil safety dorks.
Evil safety geeks.
Geeks is better than
Dude,
dorks,
I'm going to have to go buy like a pair of glasses and snap them in half and then tape the middle together before I do my next job site inspection.
And the pocket protector.
Oh, for sure.
Yeah, definitely.
I don't want to get my shirt messed up.
Okay, so that's what we're about in this podcast. But what is this specific episode about?
Oh, man, we're doing our pet peeves part 2.
Cool.
This is the continuation. I had so many pet peeves. I was so riled up last time that I asked for a continuance. I've got more stuff to get off my chest. I'm grumpy.
We need like a theme song. You know, I know we got the intro music and all that, but let me pitch an idea for you.
I don't know if I'm ready for this.
All right. Let me go falsetto, so apologize to the listening audience in advance. Pandemic pet peeves.
Have like a nice little piano like doo-doo-doo.
From Safety Pros. Part 2.
Part 2.
All right, cool.
That was terrible.
Yeah, but that's why it's awesome. So what's new, AJ? What's new with you?
Oh, speaking of being terrible, I've been terrible. I did the No Shave November and decided to grow out a beard, which honestly I've never taken the time to ever do. Never grown the beard, never let it come out.
It's December now, though.
Yeah, and still haven't shaved it.
Yeah,
just
cool.
been itchy.
I personally think it was just an excuse to grow a beard, and you don't need one, by the way. You can just grow a beard whenever you want.
You just go for it. Just grow a beard.
Yeah, you don't need an excuse to grow a beard. I mean, like if we got to wear respirators, it's got to come.
Yeah, no, it probably can't last that much longer considering our profession. Yeah. But that's what's new with me, Aaron. What's new with you lately?
My son kicked me in the head.
Excellent. I mean, you're kind of training him to kick you in the head, though.
Yeah, it sounds bad when I just say it.
Right.
I was so proud of him.
Yeah? It was a big deal.
I actually told him a couple months back, I said, dude, if you land a head kick on me when we're doing some kickboxing sparring, I will give you $20.
Oh.
And he was trying, and he was trying, and he was trying, and then I kind of forgot.
Oh, snap.
And then we were sparring. It was like an open mat. Maybe it was a kickboxing class. I can't remember.
Okay.
But I was actually trying, too. I wasn't just going all easy on him because, he's young.
You're bringing the heat.
And then, boom, all of a sudden, chin to chin, baby.
He just belts you in the head.
I was like, it's static. First of all, when you get kicked in the head, you're not happy. But then I was like, but that was my son. And so I had to tell everybody.
You were all pumped up.
Yeah, and he was super pumped. He's like, $20, you owe me $20. And I'm like, no problem.
Right
dude.
there calling you out on the mat.
Yeah, no,
$20.
For sure. And then,
awesome.
Yeah, I had to tell everybody. And then I just started enjoying telling everybody because it was so shocking to them.
Well, yeah. I mean, that's a pretty cool accomplishment.
My son kicked me in the head.
He kicked me in the head.
Yeah.
No. It's a good thing. It's a good thing.
It was on purpose. It was sweet, beautiful, roundhouse, Muay Thai kick, shin to chin, landed clean, above my guard. It was just a good job. All
awesome,
right, cool.
Man.
Well, you got any real life OSHA case studies on COVID? Because we're kind of dealing with COVID today.
Yeah, I do. Last week we were talking about kind of what had happened before. You know, how people have been getting cited with this whole COVID-19 thing, and companies were getting in trouble. And
what was it? 3.5 million.
$3.4 million so far this year in COVID response, and it's just been a little ridiculous. So I wanted to kind of let everybody know what OSHA is citing on specifically in these cases. So out of 255 cases that they've gone over just this year alone, they've been citing, the top one was implementing a written respiratory protection program.
So they're busting people for handing out N95s with no respiratory protection policy and program, right?
No written policy or program in place.
And I've actually worked one of those locally.
It comes up, dude. Every time they show up for this, they're like, yep, where's your written program?
What's number 2?
Number 2 is providing medical evaluation, respirator fit test, training on the proper use of a respirator, and personal protective equipment. So they're not doing any of those steps for the second citation.
That's just number 2?
That's just number 2.
So no medical eval.
No medical eval, no fit test, no training.
I've worked one of those too.
Okay.
Yeah, it was actually, they busted them on both, the top one, number 1 and number 2. They got them for no program,
Dang.
no medical eval, no fit test, and no training. And so you've been involved in that. We've been working that case for a couple months. Just fit testing everybody, training everybody. Yeah. It's been a chore.
I've been a lot of people trained.
Is there a number 3?
So 3 and 4 and 5. But 3 and 4 are 2 of my favorites because this is something that you and I frequently have to kind of help people through.
You have a favorite OSHA citation?
Well, it's a favorite because of how it is a pet peeve.
Oh, okay, because if you had a favorite OSHA citation, I think that classifies you definitely as an OSHA nerd.
Oh, no. So this is, you know how people will just throw the word reportable and recordable around interchangeably?
Yeah, for sure. Yeah, they don't know the difference.
And they'll just say, hey, I got an OSHA reportable. And I'm like, oh, OSHA reportable? Oh, you had a hospitalization, amputation, loss of an eye, or loss of consciousness? And they're like, no. I'm like, oh, so you had OSHA recordable. Yeah, it happens all the time. Number 3 and number 4, number 3 was report an injury, illness, or fatality.
You gave me a really good idea for another podcast topic.
Yeah.
Which would really torture listeners. OSHA record keeping.
Record keeping? Dude, I don't know if we could do a record keeping podcast. We'd lose all 4 people that listen to this podcast. They'd be gone.
But all 4 people need, they don't have a great beat on that.
Yeah, that record keeping thing is...
How much record keeping consulting do we do?
A lot.
A ton. So
we do plenty.
I think we should.
It's not a bad idea, honestly.
There's other
guys if you got
out there.
If you got some reportable questions you want to email in to the evil safety dudes.
Or do you mean recordable questions?
Or maybe recordable questions.
Or both.
If you got recordable questions, email them into us and we might throw them in one of our next podcasts if we get some good feedback on that. But then the next one, number 4, was record an injury or illness on OSHA record-keeping forms, which we covered in one of our earlier podcasts.
So, am I hearing you correctly? Are you saying that OSHA's actually citing employers for not recording work-related COVID cases?
Yeah.
Okay.
Actively citing on it.
And what is your source, sir?
OSHA.gov.
Okay, that's reputable.
I would say that if anybody's going to tell me that OSHA did something, OSHA.gov would be a good place to find out.
If it was just random safety dude blog, I'm not sure. But yeah, you're citing a good source. So
I'm sorry, it's Evil Safety Dude blog. Thanks.
I will believe your statistic there.
And here's the last one. This is where it gets a little interesting because OSHA always has this in their back pocket, and I feel like sometimes people just forget.
Oh, I know where you're going with this one.
Comply with the general duty clause.
Yeah, I call it the ace up their sleeve.
Exactly.
If it's an actual health and safety issue and they don't have an actual regulation to cite you, doesn't mean they can't. They'll just cite you under the general duty clause. And for those who don't know, that states, I'm paraphrasing, so forgive me, but it's something like, employers must provide a place of employment free of all recognized hazards, something else. Basically, you got to have a safe workplace for your employees.
And if you want to watch this film, press 1.
Is that my operator voice?
You just keep going to Mr. Movie Phone.
Okay. I don't know Mr. Movie Phone. This is
you used to call in. It was an 800 number. You would dial in, and then he would tell you the movies playing and the times playing.
Oh, I do remember that.
And then you would press to see that movie.
Yeah, now I just look it up on my phone.
Yeah, now showtimes are super easy to find. But yeah, back
I do remember that.
And he had that crazy
way back.
Do you want to see this film? Press 2. Do you want to see this film? Press 3.
All right, so that's a good case study. How
But
about
yeah,
anything from OSHA on COVID? Is OSHA come out? Because I know a lot of associations and other agencies have been putting hard pressure on OSHA to put some emergency temporary COVID standards in place. And so far, OSHA's like, no, you can't make me.
right.
But what is OSHA? Are they saying anything COVID? You got anything new?
They're
coming from
always
OSHA?
kind of saying little things, and so there hasn't been a lot of the new stuff. Everybody's been hearing the same old stuff repeated, masks, hand washing, hand washing,
Distance.
social distancing. Well, just last month, which is lightning speed in OSHA world.
Right.
Last month they came out with a brand new one, kind of going over workplace ventilation to help
Okay.
prevent the spread of COVID. And it wasn't anything, mind altering or mind blowing or earth shattering, but it was just some of those regular, if you're putting a lot of people into enclosed spaces and you're blowing that air around the facility and those people could be sick, and they don't just narrow it down to COVID, they kind of keep the whole thing open. They say things like the flu,
Yeah.
or a cold. So they say any employee, if they're feeling sick, please avoid, a workplace or somewhere with that type. Contact HVAC technicians. Make sure that your system is all up and running with fresh air and not just distributing the same air through the building. Make sure that there's proper filters in your ventilation or replacing your filters at the appropriate intervals. Because, Aaron, that's something you and I run into all the time, is people will not replace things or renew them when they're supposed to. They'll just do it when they remember.
And obviously I'm not an HVAC expert, but even in my home, I am able to get a HEPA filter for my HVAC system.
Yeah.
So I'm just assuming, I'm just going out on a limb that they provide some type of HEPA filtration for these huge industrial rooftop units for plants.
And that's actually in the mandate,
Oh,
or
okay.
the guidance. If I quote them, if you guys will bear with me, they just say to consider using portable high-efficiency particulate air filters or HEPA filter systems to increase your clean air inside the building.
So if you got more movement, more filtration, more air exchanges, that's going to reduce the spread of COVID because it's going to be pulling it through the filters and hopefully
Correct.
catching it. Okay, so we thank you, OSHA, for that guidance. And
I
if
don't
I
know,
was an HVAC contractor, I would be pushing that. I would be trying to make some money off that right now.
I
Like,
agree with that.
yeah,
Hey,
yeah.
let's upgrade your cheapo filters to some
yeah.
HEPA filters.
or just reduce the spread of COVID. Let's schedule a maintenance for HVAC system to make sure we're getting the proper air exchanges. They have these weird, CFMs and all that stuff.
Well, I got to cover all of the case studies and the updates. Aaron, did you have any new safety gear you wanted to talk about?
Sure, and new is kind of a relative term with PPE.
Okay.
But one thing that I really like, which good luck getting them right now, but since we're dealing with COVID, you have these air purifying respirators that are tight fitting, the
Mhm.
dust mask style. But I'm talking about a NIOSH approved. Everybody's dealing with N95s, but we were just talking about HEPA filters for HVAC
Yeah.
systems. In recent times, they have come up with the dust mask style P100.
Oh, wow.
Yeah, so instead of N95, which only gets 95% of microns, I forget, it's like 0.03 in size.
I always move the decimal, and I think it is 0.3.
Okay.
Yeah,
But-
0.3.
But
Or
a
is it 0.0? Oh, my God.
100, they rounded it up, but it's like 99.999997. It gets more of those
Right.
size microns. So, HEPA filters for occupational, we're supposed to use those if we're playing with silica or lead or asbestos, but it definitely works for COVID because it's
Oh, yeah.
better than an N95.
For sure.
But when I first saw P100 on a dust mask style respirator, I was
Right.
kind of excited about that because I was only used to getting HEPA grade filters on elastomeric half and full face respirators
Right.
or PAPRs. So that
All
was
of a sudden now, it's
yeah.
like super portable, a lot easier to don and doff. You don't have the
Yeah.
huge elastomeric to put on with all the straps.
And I got some.
Ooh.
Yeah, it was months and months ago. It's probably February when COVID was ramping up, and I just kind of saw that these respirators were just going to not be available. And in our line of work, you need this stuff for what we do. So
Yeah,
I made
totally.
sure I got 10 of those P100 dust mask
Ooh.
style. So that's new safety gear. All right, well, on to the main topic today. Can you remind our listening audience what we're doing today?
Oh, it's Pet Peeves Part 2.
Part two.
It's the second round of me complaining about things.
Me too. We had so much.
I
we couldn't
did.
get it done in one episode.
I got more to get off my chest.
Well, let's just jump right in. You want to start off?
Okay, all right. I'm gonna pick one that's a hot button item, but this is one that it keeps coming up, and it peeves me. It is when people condemn others for not taking their health seriously, and they're not taking their own health seriously.
I could see why that'd be frustrating.
Like, imagine the scenario: you're out in public, you're maybe not wearing a mask, okay, and you're social distancing. You're staying away from others. You know, you're just not wearing a mask, and maybe somebody who's not properly wearing a mask, not taking their own health seriously because they don't understand, they weren't trained, or whatever. They don't get it. So they're not properly wearing a mask, and every 10 seconds they're pulling that mask down to take a drink of coffee while they walk around whatever area you're in, and they decide to come up and yell at somebody else who is social distancing but also not wearing a mask.
Right.
Bugs me.
I actually witnessed that in a gas station. We're in Iowa, for those you don't know, and our governor came out with a proclamation mandating masks in publicly frequented areas.
Okay.
But before that happened, where it was just kind of recommended,
Right.
I actually saw that. I saw a guy going to a gas station, and he started condemning a gas station employee who was way working in the back, like where they make pizza and stuff,
Mm-hmm.
for not wearing a mask.
So this person's isolated all by themselves,
Yeah.
way more than 6 feet away
Yeah.
from everybody else.
And this just random guy wearing a face covering. Now, he was wearing it right, granted, but he was just really condemning somebody from not doing it. But in your case, it's even worse when they're not wearing it adequately to protect me. If they were to cough and sneeze and they didn't have it on properly, they're going to expel
Yep.
Airborne droplets. But then to yell at me for not wearing it, I think there's a word for that.
Yeah, what word? I immediately went to inappropriate words.
Okay, well, I got one that's appropriate, but it's still something you don't want to be labeled. Hypocrite.
Oh, okay. All right,
Yeah,
cool.
Yeah.
Yeah, mine is, no, we'll just leave that at the door. Mine was not a nice word.
Okay, well, so yeah, I could definitely see why that's a pet
How
peeve
about
for
you? Do you have another pet peeve
I got several.
well, what's bothering you going on right now?
We're public safety people. That's what we do for a living. But at the same time, we gotta allow people to stay healthy and to increase their immune systems and to exercise and to work out. Because to me, looking at this thing from a nursing medical point of view, if you are super healthy, you are less likely to get COVID-19 severe, your quicker recovery time, less long-lasting effects, the
So
healthier you are.
What you're saying is one of the best ways for me to stay healthy is to possibly participate in some form of exercise?
Yeah, for sure. I mean, if we're keeping our BMI in check, our fat percentage in check, if we're doing some strength training, if we're doing some cardiovascular exercise, if we're eating right, drinking right, and we're super healthy, we're just more likely to survive anything that comes our way.
It's helpful.
Yeah, and so
Extremely.
And exercising is a big part of immune health.
So how does this tie into COVID?
Well, just some of the regulations that like inhibit working out. It's just a pet peeve of mine personally. When you say I can't go to a gym and social distance and work out, but you allow me to go to a restaurant serving very unhealthy foods, and say
fast
that's
food
okay, but
yeah.
I can't go, get my body healthy. I just don't like that.
I mean, I agree, dude. Like, I can go do an activity that physically harms me, lowers my immune system, raises my risk. I can do that. That harms me.
Right.
But I can't go do the thing that builds my immune system, makes me better.
Yeah.
I agree. That's awful.
So that's just one of mine. You got another one?
I mean, more piggybacking on what I was talking about earlier, but the public shaming. The public shaming and outcry for this whole thing has really, really been just a pet peeve. It is. It's bothering the daylights out of me. People will call on others on both sides of the aisle. There's on one side, you got people yelling at other people saying, you need to be more terrified of this. You need to be treating this like this is the end all be all apocalyptic, end of the world. You're not on my level of fear. And then you got people on the opposite side of that going, you need to be absolutely, totally not worried, not scared,
Right.
nothing about this.
I could see that.
And I think that there's a healthy middle ground for both.
For sure.
This is an actual disease. It's a real life, true blue illness that is killing people. I think just having a healthy respect for what it is important. You can't write it off as nothing, but you can't treat it like it is the apocalypse.
Right. Like the bubonic,
Right? Yeah.
like Ebola.
Yeah. If
Yeah,
we
you
had an
gotta be
Ebola outbreak,
yeah.
oh my goodness.
You got to be healthy and balanced. I agree. I'm big into just let people do their own thing. To each his own in a sense. I'm gonna do me, and I really don't want you messing with me. You do you. I'm not gonna mess with you.
As long as it doesn't harm each other.
Yeah, yeah. All right, so going on, this is just a super pet peeve of mine, coming from the medical profession, working in hospitals for 10 years, and actually having to take care of patients with various types of mental and physical illnesses.
Mm-hmm.
What bothered me through this whole thing is people stockpiling medical grade N95s and like gloves and all this, gowns and all this other medical supplies when they don't ever and will never actually take care of a person with COVID-19.
Right. So what do they need it for?
Well, it's just the hysteria. It's just like
they're just stockpiling it just to have it.
Yeah, and they don't need it. They don't need a N95 if they're not doing direct patient care with someone suspected to have or confirmed to have COVID-19. Just do your social distancing, wear your face covering. But, let's try to give the N95s to people who actually need them, because when the nurses and other medical professionals don't have the PPE that they need, and so then they contract the virus because they're, reusing stuff and disinfecting it, and it's affecting the seal, so now they're contracting it. What happens to us when all our medical professionals get taken out? Who's going to care for us now?
We're going to be in a world of hurt, man.
Yeah, for sure. So, that bothers me.
I agree. That's a huge bother. You mind if I keep going?
Yeah, go for it.
Oh, gosh, I'm so grumpy. I'm going to, I don't want to have too many podcasts where we're grumpy, but I definitely want to get my grumps out in this one.
Yeah, we could go back to just annoying people with OSHA regs after this one.
Annoying? They love how we talk about OSHA regs. How dare you? No, this has been a big one, but companies that allow their employees to basically get all of their COVID information and training from the news,
right,
and then not actually giving them real training
on COVID-19
or the PPE that they got to wear.
Yeah.
I mean, all of it. It's just because it doesn't matter which side of the news you're watching. It seems like it kind of goes back to what we were talking about earlier. It's either really far one way or really far the other way.
Well, the news also changes their science daily.
Yeah,
this is okay today, and then tomorrow this is not okay today, and then the next day they go back to the original thing is okay now.
Yeah.
So if I had to total up all the employers that that I know, and or to see how much have documentation where they actually put people through basically a COVID-19 101 course, what it is, how it affects people, how it spreads, what to do to protect yourself. Actually, they themselves putting on a course, have documentation of it. It is so few and far between.
Oh yeah, I mean, I totally agree with that.
Like, what's the deal with that? Like, we're letting the news educate our people on employee health and safety. When has that ever happened before?
I mean, it shouldn't happen.
We just assume because COVID-19 is every time you turn on the radio, every time you turn on the news, every time you go on the internet. So, everybody already knows everything, so we don't have to train them ourselves.
Right.
Yeah.
Well, and then what I actually heard from another place was that they weren't going to do that because, and I actually kind of agreed with this, but there has been such sensory overload toward COVID-19 that they just wanted their employees to get a break.
Yeah, I'm not down with that because I agree there's a sensory overload, but it's not a sensory overload of accurate information.
Oh, there's not very good information going out.
You and I have trained hundreds and hundreds and hundreds of people on COVID-19 in these last few months. And I asked them questions, and 9 out of 10 cannot answer them.
I mean, yeah,
what's
that's
a
true.
face mask good for? A face covering. What's a face mask not good for? They don't know.
And you sit down and, hey, what's the difference between this respirator and this surgical mask?
And they don't know.
No, they do the same thing, don't they?
Yeah,
no, they don't. I'm sorry.
How
what's the
is
training on
COVID
that?
spread? They're like, touching.
Through my eyes.
It's an airborne droplet, people. It's a mutation of the original SARS virus. It's a sudden acute respiratory syndrome. That airborne droplet breathed in, attacks the alveoli and the bronchioles.
Well, and then I had one guy sitting out in the lobby arguing with another guy, and I was just sitting there, and I just let him be because I was off work, off hours. I didn't need to get drug into a big old thing. But the one guy going, no, even wearing an N95 or a HEPA filter won't stop you from getting COVID because COVID itself is small enough to pass through the filter. Bypassing the science of it that it has to travel in a viral load on an airborne droplet.
Yeah.
Like the virus isn't actually airborne itself. It's traveling in a droplet. And I mean, there's so much on both sides, just information, and they're not told what's right and what's wrong.
Yeah, it's not accurate. So I'm 100% with you on this pet peeve.
Yeah, don't just allow the news to train your employees. Get some real training for them.
And
actually teach them everything.
If you don't have a health and safety expert on your staff that could put together a very solid science-based course, it's not hard. You just go to the CDC website and just take all that COVID safety for employee information that's on there free. You're not plagiarizing. It's public information. Put that into a PowerPoint, and then do some Zoom training because you don't want to group people together. So I get it. But how much Zoom training have we done recently?
Oh my gosh, I'm about ready to be done with Zoom training.
Yeah, I do not like Zoom training.
I like being up in front of the group,
program
dancing
itself
around.
is fine. I'm not dissing Zoom.
No.
But it's just the whole online.
I have to sit
scene.
still now in front of this little thing,
But it's a chance for you to get compliant by you training them, and they could all be on their phones or laptops. We've trained people when we're sitting in here in our training center in Sioux City, Iowa. They're sitting in Pennsylvania in their work van.
Yeah.
So, you can get it done.
Well, what was another pet peeve you got? I only got one more big thing I want to complain about, so I want to give you a chance to throw out a couple more.
I mean, it's all kind of the same. When people are trusting everything they hear and they don't fact check it, So, like, when I was taught how to do research, it first came from hazmat training. If there's a chemical spill and we need to get information on this chemical, check this information with 3 reputable sources.
Right.
So we would use OSHA if they had anything. We would use Wiser, this cool program. We'd go to the NIOSH Pocket Guide.
Right.
Maybe we'd use Cameo. Maybe we use the DOT's emergency response guidebook.
Yep.
We would get 3 super reputable sources, and we would get the data that lined up with all those 3. And then we would believe it and use it for real life scenarios where people's lives and deaths are on the line.
Okay, that makes sense. So what's your pet peeve now?
Well, they're not doing that. They're just like, well, I heard on the news. I heard.
And with zero personal research.
Yeah, just because you say I heard doesn't mean it's true.
Right.
You cannot say this is fact because you heard it.
Well, and that's something we always encourage everybody who listens to us as well.
Yeah,
just because
I
I said something out there in the middle of a class or in front of a group, and I'm pretty confident. I did my research. I'm confident what I'm saying. But just because I said it, that doesn't make it true.
Yeah, I'm a
should
health
go look
and
it up.
safety expert. But listen to this, everybody. Gorillas fly through space on monkeys.
I thought we weren't in the Matrix today.
Well, that's not. But a health and safety expert said that on a podcast.
It's true. You have said it on a podcast.
But
now.
it's not true.
No, it's not true.
Gorillas don't fly through space on monkeys.
No. I feel compelled to go make a graphic novel at this point, but no.
But, so tomorrow somebody's like, I heard gorillas fly through space on monkeys, and I heard it from a podcast.
From a podcast.
It's true.
And he's a health and safety expert.
Yeah, so, fact check that.
Yeah.
Go to the CDC.
Yeah.
Go to NLH, the National Library of Health. Go to, what else is a good reputable? Mayo Clinic. I like them. They're super reputable. Go to Johns Hopkins University. Killer data on COVID right now. Super liking what they're doing.
Okay. But yeah, actual.
You could go to the World
sources.
Health Organization.
Yeah.
Go to legit sources that specialize in this stuff. But don't just go to one. Go to several of them.
Yeah, get as much data and information as you can.
That is confirmed, by peer review, and several of the experts are saying it. And then that's the most likely trusted info, is that confirmed with 3 reputable sources.
Yeah, that makes sense.
All right, what else you got?
All right, this is my last one. And this has been a big pet peeve throughout the whole thing, is that a company is going to make a bunch of COVID-19 safety rules, but then enforce 0 of them. And then they start wondering why they had a big outbreak in their facility or their company. And it's like, well, you came up with all these ideas. You invented all of these rules. You came up with some really good ways to prevent the spread, limiting your break room exposures, limiting your hallway exposures, masks on if you're ever leaving your work areas. Like all these really good ideas they had. They had sanitized staff. They had foggers coming through. But then zero enforcement. So if somebody's walking around the building, no mask. Who cares? You got 18 people in a 12-person lunchroom. Who cares? And it just, it drives me nuts.
I have this pet peeve for everything health and safety rule. When you have a health and safety rule and don't enforce any of it,
oh yeah,
that's a problem.
Doesn't even have to be COVID.
Yeah, that's a problem for sure. So so that was pet peeves from Safety Pros
Part D. I feel like I feel better. I got that. Got that.
And I didn't even get them all out. But,
no,
that's okay. I think we complained enough. We'll go back to annoying OSHA regs after this.
That sounds good.
But we thank you all for tuning in to the IBC's Evil Safety Dudes podcast. And I can't say see you next time. I keep wanting to say that.
Imagine us next time.
I can't even say hear you next time.
Hey, if it's the Matrix, it could be anything next time.
All right. Well, let's just Audi 5000.
Okay, bye.
All right, bye. Welcome, everybody, to our podcast with Neo and Novel. It is a story